Welcome to the What's Happening Birmingham video podcast.
This podcast is brought to you by the Jefferson County Department of Health. Hello, everyone. This is Jarvis S. Scott with What's Happening in Birmingham. Today, I have the honor and pleasure of having Dr. Michael Saag. He is a physician and HIV and AIDS researcher here at the University of Alabama at Birmingham. Dr. Saag, thank you for coming on the podcast today.
Great being with you.
Great. It's an honor and pleasure to have you on. If you all please Google him. He is one of the leading people out front about the COVID-19 pandemic from the start in March, even now. I want to bring him on the podcast to kind of reflect on 2020, what we knew about then and what we know about now. So, Dr. Saag, first time on the podcast, do a little introduction for us.
Sure. So I'm a physician at UAB. I got here in 1981 for training and have been in training ever since, I guess. I started the HIV clinic in 1988. And when COVID came along in the beginning of 2020, I was up in New York area and drove back with my son, and I picked up COVID and had it for about 2 weeks. Pretty harrowing experience. But after that point, I kind of redirected a lot of my focus on not just treating patients, but trying to educate the public as much as possible and try to get as much truth out there as I can.
Okay. So when this thing first hit back in March, first it started out in China. And at that time, we were looking at, we was just thinking like, hey, that's just regional. It's never going to cross over to our borders until March. What was your first initial thoughts when you first found out about this?
Well, the first time I heard about it was the first week of January when there was a talk at our ID conference about it. And I said, sounds a lot like SARS-1. That's the virus from 2003. And you're right, we did not think it was going to go very far because we thought it was just going to be like that, stay mostly in Asia. By the first part of March, I was going to a national meeting in Boston, and there's 4,000 HIV researchers who were coming together, and there was debate for that entire week about whether to cancel and go virtual. I was one of the people saying, no, I had the meeting, this thing ain't going to be any big deal. So it shows you what I know, I guess. And by that Friday, it became clear this was something unusual. And we canceled the meeting, went virtual. I stayed up there to help with logistics. And then I went to New York to visit my son. Interestingly, on the train from Boston to New York, I pinned an op-ed that went into the AL.com, sort of warning everybody that this thing is coming and it's going to be bad.
Oh, wow. So at that time, we initially knew it was something like the main symptom was it was just airborne.
Initially, we thought it was mostly by surfaces, remember? So we talked about wiping everything down, washing your hands a lot, but we really weren't pushing masks because we didn't have the understanding at that moment in time how contagious it was through the air. And that became crystal clear by late March. And that's when everything shifted to say, okay, yeah, hand washing is important, but it's especially important to wear masks, keep distance from one another. And something we're still focusing on is staying away from crowds of people. Stay out of any place where people are congregating, especially indoors. And to me, the place where we failed in our messaging was that we were harping on this a lot, but there wasn't a coordinated effort. Because if we're really going to do this the right way, if you look at other countries that have had success, you've got to shut down those things where people congregate. That includes restaurants and bars and schools to some degree, but you can't just do that in isolation. There has to be relief for the bar owners and the restaurant owners and the people who work there. And we were out of sync. We were not providing that. So there was a lot of pushback saying you're trying to destroy the economy. And no, we were trying to save lives, but in the process, it does destroy the economy. And so because we were chaotic and not in an organized way, this thing has bubbled over, not only in terms of the epidemic, but it's also bubbled over in terms of political circles and created a lot of divide between our country, which is really unfortunate.
And another thing I thought too when this first came out later on is we knew more about the virus was the whole thing about asymptomatic. At what point did you all kind of discover that part, that it was like, wow, somebody can actually be a transmitter but not actually be affected by the virus?
Yeah, that was actually coming to the fore probably in early April. There was evidence of people who had the virus when you test for it, but they aren't symptomatic. That represents probably about 25% of people who have ever had COVID, and they just didn't know it. And among the symptomatic people, about 20 to 30% will get really sick and have to come into the hospital. Our goal now is to, number one, stop people from being exposed as we always have. But once somebody gets infected, if we can get them treated in the first 5 to 7 days with this thing called a monoclonal antibody, which is an infusion. President Trump actually got this, and it really stopped his infection cold in its tracks. That if we could do that type of thing, that'll be helpful. But we didn't really have that available to us until really early December and now into January. But going back to April, May, we learned about its airborne transmission. We learned about the asymptomatic spread, and we did a pretty good job in April and May of flattening the curve. We just have lost our will and our way over the last 2 to 3 months.
What do you think about, this other treatment out called Remdesivir? I hope I pronounced it correctly.
Remdesivir.
Yeah. How effective is that treatment as well now?
That's a good treatment. The problem is that this virus, when it affects people, they have symptoms. There's 2 phases of the illness. The first 7 days is the virus phase. The next 7 to 20 days is the immune system phase. The reason that's important is that the monoclonal antibody and remdesivir both act in the early phase when the virus is replicating, and they stop it in their tracks, and that really helps. The problem with the remdesivir is it's got to be given intravenously by vein, and it's got to be given daily dose for 5 days. Well, people can't do that at home. And here, I'm in an infusion center right now while we're talking, we can give that monoclonal antibody over an hour and we're done. But with the remdesivir, it's 5 days. So now most people are getting the remdesivir on day 8, 9, 10, 11 when they get admitted to a hospital. Frankly, it's a little bit late for that. We still use it. It's just kind of not really at its most potent for what is happening with the person at that time. They're coming out of the virus phase and into the immune system phase. In that later phase, immune system phase, that's when steroids help. When you give dexamethasone, probably heard about that. But that's also created a problem because a lot of docs know about that steroids work. And then early on, when they make a diagnosis, they throw the steroids out. And that's really harmful because in that viremic phase, that first part, if you give steroids, you impair the body's ability to shut the virus down, and that prolongs the illness and prolongs the time of shedding. I know this sounds real complicated, but it's really pretty simple. 2 phases of the illness, use antivirals early, remdesivir or monoclonal antibody, use steroids late if you need to.
At what point, and I noticed this about, like some people may get headaches, some people may get fever, while some people get pneumonia and flu. Why is it that with this?
I don't have any idea, but everything you said is true. The symptoms from COVID are an entire spectrum ranging from no symptoms at all, that asymptomatic, to severe respiratory failure and going on a ventilator and potentially dying. And in between, there's neurologic things, headache, fuzzy thinking, There's respiratory things, cough, shortness of breath. There's heart problems, chest pain, uh, rapid heart rate for no good reason. There's GI trouble, nausea, vomiting, diarrhea. There's skin rash. So it's pretty much every organ system can be affected by this, and it's totally unpredictable on any given person, and everybody's experience is pretty much unique to them.
Well, I'm gonna go back to the point you said about the ventilator. At what part do you all determine when somebody get in there, it's time to put them on the ventilator? And what is like the long-term effects of the ventilator after the person's off of it?
Well, this is also an interesting historical thing, because back in April, May, we were worried about transmission of the virus, and so we were quick to put people on ventilators. Where we learned over the last 6 or 7 months that that's not a good idea. We try to keep people off of a ventilator as much as possible, and there's tricks and ways to do that with high flow oxygen and some other things. But once somebody really, really needs a ventilator, what that means is that their lungs are no longer able to sustain enough oxygen in their bloodstream and ventilate themselves. They get put on a machine that breathes for them. And you're right, there's complications of that. Sometimes it's hard to get people off of the ventilator, and sometimes there's scarring or other things in the lung that have long-term consequences that may not completely resolve.
So what's sometimes the chances of, I guess, living after,
Yeah. In
like
general, if somebody goes on the ventilator, their chance of dying is about 30 to 50%.
wow.
So once you go to a ventilator, you're in trouble. And we're pretty good at keeping people, getting them off the ventilator, but sometimes we fail and people die.
Okay, another myth I want to go with just came to mind that I don't want to, pass up a chance to ask you, that I've heard people say, well, I've been around 12 people, and I've been exposed and I didn't get it. What explanation you have of the people who make that type of, I guess I'm gonna call them COVID deniers, but
Lucky, lucky, lucky.
okay.
This is like Russian roulette. You got a chamber, a bullet out of 6 chambers. You spin it, you hold it to your head, you pull the trigger. Okay, so they got lucky 12 times. The 13th time, they won't be so lucky. And so the point is, you're correct that people start getting emboldened, that they say, well, everybody's telling us to shut down. Everybody's telling us to wear a mask. I'm doing fine. The people who we're seeing right now who ignored the warnings about going out for Christmas holiday, for New Year's, Thanksgiving for that matter, they pick it up, and now our hospitals are exploding with cases. Literally, we've got all hands on deck. The beds are full. We're having to really do a lot of things to keep people out of the hospital, treat them at home. It's really stressful for all the healthcare workers and the patients and their families. So you just got to trust us when we say this is bad. It's really, really bad. And you don't want to be that guy who goes on the ventilator and said, as they're putting the tube in, they say, I should have listened. You don't want to be that person. You can protect yourself. And I'm not sure why there's so much distrust, because there's nothing in it for me or any of the other healthcare workers to take on this mantra and say, stay safe. But we're doing it because we're trying to not only protect the people from getting sick and dying, we're also trying to protect their family and also the healthcare system from being overwhelmed.
Okay, what? And then now when we just thought, I want to say we're out of the woods, we start hearing news like 2 weeks ago about these new variants, like United Kingdom and Africa. What do we know about that so far?
What we know is that every virus that I know of mutates. Think about flu. You got to get a different shot every year. That's because it changes, it mutates. This virus is no different. And it just by chance that it mutates in a way that makes it more efficient in transmission. When that happens, it's got a growth advantage. It's got a survival advantage. It goes back to Charles Darwin, the survival of the fittest. And when that variant, just by accident, happens, it starts to grow in terms of infecting more people, and it becomes the predominant species. That's what's happening right now. So we knew that this virus was very infectious back in February, March, April of last year. Now it's even more infectious, which means we have to triple down on all of our things to keep ourselves safe.
Okay, so now that I guess we got before I go, well, let me go back this. Let's talk about your personal story, how you when you dealt with it, when you came down with it. What was your symptoms initially and things?
So I was up at that meeting in Boston. I went to New York. My son and I drove back together from New York to Birmingham. Unwittingly, we didn't know it. He was already infected with COVID when he got in the car, and so we're breathing the same air for 20 hours. And I picked it up. His course was mild. He's in his 30s. I'm in my 60s, and I started getting sick. First 5-7 days, not too bad, but by day 7 in the evening, I would start getting chills, fevers, cough, shortness of breath, headache, what I call fuzzy thinking. Felt awful, couldn't sleep. But by the next morning, I'd feel okay. And so I thought, okay, it's over. I'm going to move on. And then that same night, same thing happened again. It's like Groundhog's Day. Every day, I'd wake up in the morning okay, and by that night, boom, came right back. And I didn't know if it would ever end. The horror of it is in those nights when I start getting really sick, is not knowing what the next 15 minutes is going to bring. Am I going to get sicker and sicker, end up in the hospital, maybe on a ventilator, or am I going to survive the night? And that horror is god awful. I wouldn't wish it on anybody. And every patient who I know who's had this disease, that's that deep-seated fear of not knowing what's next and will I survive this? So again, don't catch it. Do what you can to protect yourself. It's very important.
Do you experience any long-term effects other than that normal cough? Which
Yeah, no, I'm just wearing this mask. It's irritating. Not really. I mean, I lost my sense of smell. It hadn't come back fully. It affected my hearing, and there are people that have that problem, and my hearing hasn't come back. I've had to get hearing aids. That's not the same as it was before. I'm not quite as fit, not that I was in great shape, but I found if I walk 2 flights of stairs, I get winded. That didn't used to happen. There are other people, though, who have what's called long COVID. And long COVID is a syndrome where after the acute illness is over, after 3 to 4 weeks, they persist with either headaches or fuzzy thinking. Some people get dementia. Some people have respiratory problems. Other people have something where they stand up, their heart rate shoots up to 150. That's called dysautonomia. And we don't know why it happens, but it's real. And I'm guessing about 5% of the population of people who have COVID end up with that. And it's going to be a plague that we're going to suffer with even after the vaccine takes hold and we start to dampen down new infections. There's going to be a cadre of people with long COVID who are going to suffer for quite a while.
What do you think about, your beginnings, you're mostly known for your HIV and your AIDS research. How does this pandemic is similar or different from HIV and AIDS?
It's a good question. I think what's similar, of course, is it's an infectious illness. It's transmitted from person to person. The messaging around how to protect ourselves from catching it is difficult. In the case of HIV, it's about sexual exposure, and it's hard to preach about condom use and that type of thing. In COVID, it's preaching about wearing a mask and keeping distance. There's a lot of resistance. People don't want to be told what to do. I understand that. But on the other hand, no one's telling people what to do just because it's something to say. There's a reason behind it. That's similar. The other thing that I learned by being a doctor of a lot of HIV patients over the years, when I got it, I knew it was critical to get out and tell my story because that helps soften the disease in the community and helps people begin to understand it. So I did that. I was on the news a lot. I wrote a lot of op-eds. I still do that because I think getting out and being public is critically important. And I think the other thing is telling the story like I just did about how it feels to be scared of this illness. And that fear of the unknown, of what's going to happen next, is incredibly real and is very much worth focusing on.
Okay, well, I want to look into, I know we can't be, Las Vegas predictors or listen to a crystal ball. What do you think these next 6 months going to go as far as the vaccines and the effectiveness of, trying to, against COVID?
The vaccine is a miracle. we look for things in our life maybe that are miracles. We read the Bible or whatever, and we hear about biblical miracles. This is a miracle in our lifetime. Because imagine where we'd be right now if the vaccine trials had failed.
Mhm.
And that was possible, but they were successful. But right now, we're in the biggest surge of cases we've ever seen.
Mhm.
If without a vaccine, why would that stop? What's going to happen that's going to make it magically go away?
Mhm.
Nothing. So
Mhm.
we would be in the same predicament next Christmas, and maybe the Christmas after that, and maybe the Christmas after that. And that's a pretty overwhelming thought to imagine this thing just not going away. And that's probably where we would be. But instead, we do have a vaccine. This vaccine is our saving grace. This is going to get us out of this. But what it's going to require is all of us to roll up our sleeves literally and get the shot. I know there's a group of people, 70%, who say, yeah, I'm there. But there's 30% of people who don't want to do it. One, because they don't think we know as much about the vaccine as we need to. That's somewhat true, but the fact is the studies have been done and they work well. Other people think like the government is experimenting on them. And I understand that too. That's happened in the past, especially in the Black community. But on the other hand, this study was done with all types of patient populations, and everyone is being asked to participate. It's not singling out one group or another. Then the third thing gets back to what I said earlier. People don't like being told what to do. So I'm not going to tell people what to do. We have a choice, but by getting a vaccine, we're protecting our family. We're protecting our loved ones because we could be bringing that home to them. And if we're vaccinated, we won't do that. And we'll get rid of this once and for all and can move on to a happier life. When will that happen? If everybody participates, I would say by the end of the summer, we should be coming out of this. And next Thanksgiving and next Christmas will be normal.
All right, one more thing I want to go back, and it just came to mind. I guess what was unique about this also, this virus, was the possibility that you can catch it twice
You
after
can.
initially getting it.
We have cases for sure of
Uh-huh.
people who had it and then got well, and 5, 6 months later got sick again. Now, it's not the rule. How do we know that that would happen? Well, the virus is a variant of what causes the common cold. So how many of us have had the common cold a couple of times? Most of us. So this virus is in that family, and our immunity to this virus, once we get the infection, is there for about 4 or 5 months, and then it wanes, it goes away, makes us susceptible again. The vaccine's immunity that it induces is better and more longer lasting than the immunity from actually getting the virus itself. So we're asking people who've had the infection, wait about 3 or 4 months and then get the vaccine because that'll help us keep this under control. But you absolutely can get this virus a second time. Not all that common so far, but it does happen.
Okay, so any final thoughts? I know we kind of covered a lot of things today. You want to tell people, because one thing I always like to tell my viewers is that YouTube is forever. So anything you want to tell them that maybe, not going back to the crystal ball,
Yeah.
that you think.
My final words are that we're all in this together. We're
Okay.
a country right now that's pretty badly damaged. We're torn apart. We saw the near riot on the Capitol building yesterday. This is not normal for us. We are not that type of country. And I'm fearful that if we keep pulling apart and we keep doubting what the truth is, and we only believe what we're hearing from one source, and we're not really being critical about our thinking, this COVID epidemic will persist. We can't afford that. We need to come together. We need to listen to the trusted voices, the people who are the true experts. They are not there to trick anyone. They're there to help, truly. And if we all could just listen to the people who are in the know, follow their advice, we'll get through this and we'll be out of it. And I really hope and pray that we do.
Well, Dr. Saag, anywhere people can reach you if they want to hear more about your story or they got questions?
Yeah, I think probably the best way might be through the UAB. I don't know of of a great way to reach me.
Or your Twitter.
Yeah, Twitter. That would be a good. Yeah, so I'm MSAGMD. That's my Twitter handle. So that would be a good way to reach me.
Okay. Well, I want to thank you for sharing your personal story, but I also want to thank you for all your work you've done over the past year, really trying to find out more about this virus and how to beat it, and also letting the public know that, hey, we really need to be careful and wear our mask like you're wearing your mask now.
Yeah.
And everything. So feel free to come back in the future. I definitely want you back on a segment to talk about HIV and AIDS research, because that's very interesting to me, and I think viewers would love to hear about that.
Sure, happy to come back anytime. Thanks for having me on.
All right, so thank you all for watching this video. Please check out what'shappeningbirmingham.com for more videos, and don't forget to subscribe to my YouTube channel. Thank you all again, and have a great day. Bye-bye.
Thank you for watching the What's Happening Birmingham video podcast. Please check out our website, app, or subscribe to our YouTube channel for the latest videos today.